Hi, everyone. Welcome back to the industry track. I'm Melanie Lang. I'm the moderator for the industry track for this section, and I am really excited to announce these next couple of presentations. We are starting off this section with a couple presentations related to healthcare, and then we will finish up the day with an aerospace panel. So our first set of presenters are here on the screen with me. We have Jacqueline Lee and Rachel Tobin, and they're going to talk about healthcare and 3D printing. Take it away, ladies.
Thanks so much, Melanie. Just going to share our screen.
Present content.
Oh, present, okay.
There we go, screen 2.
Okay, excited to get started. Welcome, everybody. My colleague Rachel and I are delighted to be here. What a fantastic space to foster diversity and knowledge sharing in the wonderful world of 3D printing. Just a quick introduction. This is Rachel Tobin. She's an electrical engineer and is our co-lead of our production and design team. I'm Jacqueline Lee, the CEO of PolyUnity. So we were founded about 5 years ago by 3 Canadian medical doctors. After watching NASA solve a problem by sending a digital file and 3D printing a repair part in space, the vision for PolyUnity was born. We've reinvented ourselves a couple of times, from simulation tools for medical training to face shields during COVID to now a fully managed additive manufacturing solution. But our why has always stayed the same. Digital inventory is revolutionizing healthcare procurement, enabling us at PolyUnity to improve healthcare experiences. Here's a quick case study of one of our first products. In early 2021, when the COVID vaccines were first made available, they arrived in large pizza-style boxes, about 1,000 vials to a box, all very tightly packed under extreme cold storage temperatures. There was no easy way for healthcare workers to break down into smaller quantities for distribution and transportation. It resulted in ad hoc solutions which saw high levels of spoilage and breakage. And healthcare workers wasted a lot of time trying to manage and provide safe ways to ship these vials. So we were asked if we could help. Within 2 days, we had prototypes of customized stackable trays of various sizes. And within a couple of weeks, after several iterations, we had hundreds of these manufactured and distributed throughout the province. We believe we played a part in having the highest vaccination rate and one of the lowest infection rates in Canada. Traditional procurement is complex with many steps and resources involved. Furthermore, healthcare organizations are being asked to do more with less. COVID uncovered many vulnerabilities in the healthcare system that were certainly present before, but not obvious before the pandemic. Here are some global healthcare challenges that we're trying to address. Supply chain disruptions are now common, creating unreliability and extreme cost fluctuations. Procurement processes are complicated and slow. Costs for parts and devices are rising, including transportation costs. Because of supply chain disruptions, hospitals are forced to overstock certain items or run the risk of shortages or expired products. Healthcare traditionally has huge barriers to innovation. Innovative products and services often take years to trial, validate, and adopt. Medical devices lack customization, and healthcare workers are forced to incorporate inefficient products into their workflows. So here's a brief video that explains how we are addressing these challenges.
When it comes to any medical facility, you're talking about a lot of moving parts. Thousands of tools, parts, and pieces of equipment just waiting to be repaired, replaced, or invented. Because your workflow can always be made more efficient. And who knows your job better than you and your team? Efficiently managing all this inventory doesn't have to be a balancing act between logistics and quality of patient care. Say hello to PolyUnity. We make your work life easier by collaborating with you and your team to make great ideas a reality, transforming your ordinary supply closet into a digital warehouse through the power of additive manufacturing. With fully managed on-site or local 3D printing solutions, our cloud-based platform brings the supply chain to you. Define, design, and digitize. That's it. Our vast digital library lets you see what other healthcare organizations and networks are doing, allowing you to share your great ideas with the rest of the world. Everybody wins. Our team of expert product designers and engineers collaborate with you and your team every step of the way, from testing prototypes to the finished product. Working to your required specifications, we'll upload the 3D designs into our proprietary i3D Health portal. All you need to do is click. Once a design is uploaded, it's in there forever. The only place it's going is wherever it's needed. No more slow and costly administration and procurement or sourcing legacy parts. No more costly expedited shipping or large carbon footprints. With PolyUnity, you get exactly what you need when you need it. And that's more efficient processes with higher quality of care. To learn more about PolyUnity's i3D Health Portal and additive manufacturing as a service, visit polyunity.com.
Great. So that was a little bit more about who we are and some of the things we're involved in. So I'll go on a bit of a deeper dive now on what we actually do. So we have a product catalog that has about 300 products in it right now, full of ideas that we get directly from frontline healthcare providers. So it's really about empowering them to share their problems with us, and then we work as a creative partner to try and come up with a solution. So we kind of lump these products that we have into three main pillars. Innovate products, which a great example of that is what Jacqueline just went over with the vaccine vials, products that don't exist yet, but that are needed to improve a workflow or a pinch point or anything like that. Secondly, we have improve. So these are really addressing inefficiencies in workflows. And I'll tell you more about an example of this one in a minute. And also immortalize. So things that you can't get anymore, we really leverage our digital inventory to help you get that whenever you need it, even if you can't get it anymore the way you used to be able to. So here's a little case study going about a great example of an improved product. I think this one really encapsulates that for us. So this one is one of our longest standing projects, and it's in collaboration with the Cancer Care Department here in St. John's, Newfoundland. For anyone who doesn't know St. John's, Newfoundland, where you go to Canada and then you go all the way east, and that's where we're situated. So before PolyUnity, patients in Newfoundland undergoing radiation therapy for cancer affecting a high detail area like ears, mouth, and nose would have to undergo a plaster mask process where a radiation dosimetrist or someone who does treatment planning for cancer would essentially paper mache the impacted area to get a positive mold as a base to create a bolus. And a bolus is just a skin equivalent material placed over the affected area, kind of to trick the machine, the radiation machine that is, to target the right depth of treatment. So you can imagine this paper mache process was incredibly uncomfortable and even traumatic, especially for a person already enduring such discomfort and pain. They would have to come in specifically for this procedure, and our province is very spread out with very many remote areas, meaning that people would have to drive for over 12 hours or even fly in some cases, spending a night by the hospital just to undergo this procedure. Also in Canada, it's a publicly funded healthcare system, so you can imagine the impacts that this had on the bottom line across the board. But we're proud to say that no one in Newfoundland will ever have to undergo this again, because PolyUnity now uses the existing CT scans that patients are already getting instead of requiring that facial molding procedure. So in doing this, we prevent additional unnecessary appointments. We redirect highly skilled dosimetrist time toward treating other patients instead of manually sculpting these molds. And the overall patient experience is much more comfortable in the grand scheme of things. We're also investigating now the use of a handheld scanner. Scan-to-print technology has really come a long way in recent years. And the nature of cancer is, even if you get a scan one day, it can transform itself in a short period of time. So there are times when the patient comes in for their follow-up treatment and the scan that they had before doesn't match the way that their face looks now. So we're investigating cases where we might be able to use these handheld scanners at really low cost points to allow the patient to still get the treatment on time without prolonging those treatments. Another example, this one I think really speaks to the immortalized pillar of our product suite, but this was a project completed in collaboration with the Recovery Center, which is a mental health and addictions treatment center located in Pleasantville, Newfoundland. This facility accepts inpatients struggling with addiction and provides smoking cessation therapy to them during their stay. The counterfactual to this product was the center spending a large percentage of their budget on purchasing inhalers in boxes with nicotine cartridges, but many of which could not be used because the patients would go through one cartridge and then maybe lose the inhaler, or maybe they would only be in for a number of hours and then they'd have to open up a whole new box for a clean inhaler, just to waste all those cartridges behind. So many of them can get used even to the scale of hundreds, and the original manufacturer refused to provide the mouthpieces without the cartridges when the center asked for them, which resulted in thousands of wasted cartridges and dollars. So we worked with that team to come up with an alternative that could be produced on demand, which was compatible with their existing cartridges, which enabled them to cut costs and spend their budget in much more impactful areas in this center. And actually, hopefully there's no background noise, but we have some members of our team post-processing these as we give this presentation. So all of these examples that we've given really come into the Polyunity additive manufacturing as a service solution. So we throw together the design work, the 3D printing, leveraging a digital inventory. So whatever you need, you can have it on demand. And in this place, we have idea intake, ordering existing products, value metrics, approvals and audits. And we call this web portal i3d.health. So if you remember those 3 I's that I spoke to earlier, we have innovate, improve, immortalize, and I'll leave it to your imagination what the 3D means. But this is our web portal that any user that works with us has access to order parts from a peer-reviewed network. So we work directly with infection prevention and control and procurement within the hospital network to make sure that all of our products are, not just something you've downloaded online and you think it's going to work, but it's an actually validated by a healthcare professional product that checks all the right boxes for quality and risk standards. But also it's a great place for healthcare providers to just drop their ideas, or as we like to phrase it, their problems on us. So we really try to empower those healthcare providers to identify pinch points, and we work with them to come up with a solution. And these solutions impact in a couple different buckets. So as Jacqueline stated before, we're really organized around improving healthcare in lives, services, and outcomes. We're all patients, our families, our neighbors, our communities are all patients in the healthcare system. And so ultimately we're serving the people that we love, and we really take that into consideration when we put into the design work when we're designing quality products. We also strive to reduce healthcare inefficiencies and costs. So a great example of this, it always blows my mind what would take a piece of healthcare equipment out of service. It could be something as simple as a scratch, and you can't get that repair part. You can only buy, basically half the assembly, or you have to buy one repair part with 7 other repair parts that you're never going to use. So we're really trying to put the power back into the healthcare organization to let them fix what they need and reduce those inefficiencies, even including reducing the number of required patients, appointments, like I spoke to in the bolus service example. A beautiful part about additive manufacturing is a decreased environmental impact. The parts that we produce are produced wherever is local to the user. So we're operating here in Newfoundland, but also in Ontario, which is in central eastern Canada, out of Ottawa, which is the capital city there. So here in St. John's, we're right next door to one of the hospitals we serve, but within a 10-minute drive of all the other ones. And we're actually right inside the hospital in Ontario for the primary hospital that we serve. So you don't need to wait for, in our case, a boat to come in because we live on an island, or the plane to get in, and all the carbon offsets that come from that. And we're also able to replace some single-use products, kind of like the example with the inhalers, with parts that can be reused. We're prolonging the useful lifetime of medical equipment by providing repair parts, especially when some of them don't exist anymore. We're preventing commutes for additional appointments by streamlining workflows and removing inefficiencies. And the socially conscious innovation side of things really comes into empowering the users that we work with. The healthcare providers really own a piece of that solution. And they we get to see the pride, when you can say, oh, this was Jacqueline's idea. Did you see this amazing thing that's helping us out? So that's also a fun part of it. And the employees at the company are really passionate about what we do because it's an easy mission to get behind. At least I'm biased there. Just to quantify some of those impacts that I was speaking to date, we have filled over 550 orders. We've we're approaching 7,000 products delivered and 400 ideas submitted, and we're engaged with over 30 departments across our facilities. And you don't need to take it from me. We have some testimonials in there just to highlight what we're really focused on, which is leveraging additive manufacturing and the speed you can get with that rapid prototyping to get to save money in the healthcare system and give people access to what they need on demand. So it's really amazing. I'm sure everyone here has their own stories about how additive manufacturing has changed the way they work and the way they live their lives, but we're really leveraging it to put the power back in the healthcare organizations and empower those users to reimagine better outcomes.
So we've been deeply integrated into 2 large hospital networks over the last 2 years. We've learned that hospitals experience the same challenges and require similar solutions. We have found valuable applications of 3D printing in any department, from newborn screening to the OR to biomed to cancer care to labs to infrastructure and everything in between. We've developed solutions for one hospital that are now being used in other networks. It is amazing to see those connections and collaborations happening. So we are going to leave you with this short video that describes how we've improved healthcare experiences through 3D printing. This company was founded out of an idea. Our team here at PolyUnity had a theory that a lot of the solutions existed inside of the minds of frontline healthcare workers.
They've created with their portal a suggestion box where if we can come up with something that we want, that we think that 3D printing could help us with, we just put it in. We can be as elaborate as we want with our request, or we can just have the suggestion. And I've had suggestions with them, and they have just run with it.
Techniques in healthcare and helping patients are as old as time, and the people who practice them as healthcare professionals are so skilled, but there's so much room for 3D printing and additive manufacturing to help them do their jobs more efficiently and with less frustrations.
Each time we need an inhaler, we have to purchase a new box. So it gets quite costly. So we reached out to the company, and they unfortunately would not send us a quantity of inhalers. And I thought, if there was a way that we could get that made by someone, it would really help.
That's where PolyUnity comes in, and we're trying to create tools that not only help healthcare providers get what they need faster, but also help them improve the way they do things, if that's possible, because no one knows the problems that they face as well as they do.
So our i3D portal is an online cloud-based software. It gives our users access to a digital library of all of our products. And you can see that growing week by week as we get new ideas from our multiple organizations. It's a place where our community can see what other hospitals are doing and using, and it can really generate new ideas, new creativity. So we're really excited about bringing this together to a larger global community of innovators.
That's really one of the big reasons why clients are such a big part of the design process, or one of the reasons why they should be so proud of what they have accomplished, is after they help us create a product, it doesn't just help them. It goes on our i3D portal, and any hospital who is currently affiliated with us can order that product, request to test that product, make modifications to that product.
Once the product is furnished and is put in the portal, then really the frontline staff take it over. That's what makes it so seamless. You don't need a higher level of bureaucracy to get various different layers involved. It's driven right down to the front line and lets them do the work effectively.
And I'm a registered nurse by trade, and technology and coming up with innovative ideas is nothing really that I really thought would blend with healthcare.
The response we've gotten from end users is that the i3D.health portal allows that easy interaction. It's a seamless process from idea to product delivery and all the steps in between.
It actually makes me think more about, what could we do different in our day-to-day operations?
Sometimes it sparks an idea that wouldn't have been there before, like maybe they're having the same problem, but they didn't even think that 3D printing could solve it.
It's so exciting for us every week to see that database of ideas growing. And you see different frontline workers collaborating with each other, being part of the creative process. I hope they're talking about us at the cafeteria table, that they were so excited to bring us a problem, and now they have a solution in their hands that's working. And it was a fast, easy process. So thank you so much. We'd be happy to take any questions if the audience has some.
Thanks so much for that presentation. We do have a couple questions in the chat, and we have a few minutes, so this should work out quite well. The first question comes from Pam Waterman, and she asks, what is the polymer material for the 3D printed inhalers, and did it have to be biocompatible?
Yeah, I can speak to that. Thanks, Pam, for your question. We are using food safe PLA to make these. And these are a Class 1 medical device. So here in Canada, we have a Class 1 medical device license that we use to manufacture these. But it's a food safe PLA.
Okay, great. And then we have another question, which is actually multiple questions combined together. So I'll ask it, and then you can decide how you'd like to parse it out. How do you see 3D printing helping more in the future? What applications, et cetera? And where do you need help from industry?
Oh gosh, that's a loaded question. We can go on for forever about this. We have many thoughts on where the industry is going, and it's all super exciting. I think the scan to print applications are incredibly exciting. We can get really customized solutions specific to a person's body or shape or needs, and there's automation tools that come with that, so you can get really customized solutions with automation, so you can keep the cost low and have the speed of delivery still in place. So that's exciting. You can see customized orthotics or knee braces, for example, or even prosthetics that I think Kelly's going to speak about after us. What else, Rachel?
One of the trends that we've noticed, which is amazing, kind of the more we integrate ourselves within the hospital, is that every department that we speak to has a different use case. And that's the beauty of the way we work, which is, listening to those clients and understanding their problems, because no one knows their problems the way they do. And we kind of work with them to come up with solutions. So like Jacqueline said, kind of those customizations, 3D printing really shines in those customized solutions, and the CAD tools behind that are becoming ever more accessible, and it's exciting to kind of work with those to see how things go. As well, I guess, kind of to get everyone excited for Kelly's presentation, she spoke on a panel earlier about generative design in CAD, and it's amazing. You can put some dimensions in, and the software can take it away. So it's really exciting.
I'm going to follow a little bit on what Rachel just said. I think as the technology improves and we can start to trust more and more the output that comes from these printers, and then the materials we use, we see them inside of doctors' offices, inside of clinics, in more remote areas.
Mm-hmm.
So right now it's very fully managed. We want to make sure that we touch and feel and do some post-processing on every product before it. So it's fully managed, and we manufacture and fulfill all the orders. At some point, I would think maybe hospitals take that part over themselves, or even clinicians with the capabilities and automations that the 3D printers have. We can manage, we can even network and manage the printers from our site, even though they might be in remote areas. So with Canada and even Newfoundland specifically being as dispersed geographically as it is, I think the quality of remote care and the access to really quality medical devices in these remote centers is going to improve drastically. And we're excited to be a part of that.
Absolutely.
Hey, that's great. Thanks so much. Thank you for joining us at TIPE. Congratulations on all your success with your company. And thanks again for joining us.
Thank you, Melanie.
Thanks for having us.
Thank you, everybody.
Take care.